Hi there, and welcome. I am Dr. Jonathan Ramnauth, a sterile compounding pharmacist at Olympia. As a board-certified sterile compounding pharmacist, I'm here to walk you through how to administer an intracavernosal injection. Here's what you will need: your prescription, your vial, alcohol swabs, and syringes. When administering an intracavernosal injection, we recommend using either 30 gauge, 1/2 or 5/16 needle. It should look something like this. Let's review how to read the syringe and ensure that you are administering the proper amount of medication. These ticks represent 5 units, 15 units, and so on. Dosage should be measured with the top part of the syringe stopper. When we get to the demonstration, we will go over how to withdraw the medication into your syringe properly. But first, let's review the injection sites. Here are some ground rules. Never inject the top or bottom of the penis. Avoid veins and inject directly into the penis closer to the base. After injection, apply pressure to the injection site for approximately 1 minute. Rotate the injection site to avoid scarring. The proper location for injection is at the 9 to 11 and 1 to 3 o'clock positions, between the base and mid portion of the penis. Avoid the top and bottom of the penis to avoid potential nerve and urethral damage. The vial label contains essential information like how to store the drug product, the volume, and the expiration date. Proper hygiene is important. Wash your hands and keep the penis clean. Let's open the vial and prepare the syringe. If this is the first time you're using your medication, you will need to open the vial. To remove the foil lid from your vial, first, locate the perforated ring in the center of the metal vial cap. Next, use your fingernail to loosen and remove the perforated section. Ensure that you only remove the inner foil ring. Wipe the rubber stopper with an alcohol swab prior to use. If you are struggling to open the metal cap, please stop and call the pharmacy at 407-673-2222. You will puncture the needle through the exposed gray rubber stopper on the cap. There are a few things to keep in mind. Check the fill volume of the medication. For example, this vial has a 2.5 milliliter fill volume. For lower fill volumes, you will need to ensure the needle goes deep into the vial in order to make contact with the drug liquid. Keep the vial at a 90-degree angle when withdrawing the liquid. Let's get started. After removing the cap of the needle, pull the plunger back to the dosage prescribed by your doctor, filling this volume with air. Use the new needle and syringe each time. Insert the needle through the rubber top and inject the air into the vial. Turn the vial with needle and syringe inserted upside down. Pull back on the syringe plunger in a slow and steady motion until the prescribed dosage is achieved. Tap the side of the syringe to allow any air bubbles to float towards the needle. Take a moment to inject out the collected air bubbles that may have formed. Clean the site with an alcohol pad. Grasp and pull the head of the penis towards the side of your leg with the index finger and thumb. With a steady and continuous motion, penetrate the skin with the needle at a 90-degree angle. The needle should then be advanced to the hub. Slight resistance is encountered as the needle passes into proper position within the erectile tissue. Inject the TriMix over approximately 4 seconds. Withdraw the needle from the penis and apply compression to the injection site for approximately 1 minute. Now that the dose has been administered, carefully remove the needle. To properly dispose of your needle, discard in the sharps or safety container. If you do not have one, please visit the website below. Safety tips and warnings. Store the medication frozen and de-thaw before use. Do not inject more than 1 dose within 24 hours. Follow your prescription. If you want to change your dosage, consult your prescribing physician before doing so. If an erection is painful or lasts longer than 4 hours, please seek medical care immediately. Priapism is a prolonged erection that lasts longer than 4 hours and is not caused by sexual stimulation. It is a medical emergency that requires immediate treatment to prevent long-term complications. Phenylephrine is a medication that can help treat priapism. If your erection lasts longer than 3 hours or causes discomfort, inject 50 units intracavernosally and repeat as needed every 5 minutes. Do not exceed 5 milliliters within 24 hours. Go directly to the emergency room if your erection does not go down after administering phenylephrine. And that's it. You've successfully administered TriMix. For dosing recommendations, it is important to abide by your medical provider's instructions. For more information about compounded TriMix, visit olympiapharmacy.com or contact a pharmacist at 407-673-2222.